So hello, my name is Gabriel Vidales. I will be giving this informative video on the ART syndrome. So let's start with the history of this syndrome. Well, there isn't really much history to it. That is because this is a rare disease and few documentation has been done. However, there is a very distinct case going on between a Dutch family and an Australian family. And I mention this because both of these families have a genetic mutation that's very similar to each other. And that specific gene, that gene is called phosphoribosylpyrophosphate synthetase 1. I would just be calling it PRPS1 for short. So I have to say the whole mouthful. Now we have identified this with the use of linkage analysis. This is a gene hunting technique that allows us to track patterns of diseases in high-risk families. All right, and now this gene is very important. How important? Well, if you want to perform basic activities of daily life without any trouble, this is for you. This is what you want to perform normally, because this helps create purines and pyrimidines, which are building blocks for RNA and DNA. And it is also very important for creating ATP and GTP, which gives energy to your body, right? So how does one get something like this? Well, no one can really cough on you or touch you, sneeze on you, and you won't get it. This is an inherited disease. So what this means that you have to be given this gene by an offspring. So this is a X-linked recessive gene, right? Which explains how rare this really is. This is directly linked to the X chromosome, and this is a very important note to make. Mothers will always give this and pass it down to their offspring. It will never be their father, because children, males specifically, that have ART syndrome will never live past the age of 8 years old. Right? Okay, so what are some symptoms associated with ART syndrome? So some symptoms that are associated with it are sensory neural hearing loss, which is damage done to the inner ear nerves, the organs, that doesn't allow for hearing, right? You have hypotonia, which is the loss of muscle tone. You have ataxia, which is impaired muscle coordination. You have neurodevelopmental delay, which is you're not meeting your childhood milestones as expected, right? And you have peripheral neuropathy, which means you'll be losing signal of your limbs, and you will not be able to communicate with your limbs, which would mean you'd have progressive tetraplegia, right? So that would be very vital. Okay? Now, it is very, very, very important to know that a lot of these symptoms I just noted, they mainly affect boys. Now, and let me explain. So women, they can have this ART syndrome, but their symptoms will not be as severe. They will be probably mild to none. However, one that still stands is optic atrophy. Optic atrophy occurs to both of them. However, optic atrophy occurs later, around the early ages of 20, 21 for women. So it is very important for women to keep on track of their immunizations, of keeping good health, so they can follow up on this optic atrophy successfully, right? Now, how does one doctor diagnose ART syndrome? So there is no formal diagnostic criteria for this, which makes it very difficult for diagnosing ART syndrome. So doctors will always do their best to look at their medical history, look at signs and symptoms, physical exams, laboratory tests, etc. Right? And some signs that will help tell if a person does have ART is if all the signs and symptoms I just mentioned before occur before the age of 2. Okay? Now, there's some laboratory tests you can perform. Serum uric acid concentration. Now, as I mentioned before, if there is an abnormality with PRPS1, that means less purine, pyrimidine, ATP, GTP will be produced, right? So right here, concentration for people who have ART syndrome will usually have the lower the normal, but it will still be in the average spectrum. So what I'm talking is 0.12 millimoles per liter to 0.35, which is the normal range. Now the lower end of that spectrum would be 0.13 millimoles per liter to 0.16 millimoles per liter. So you can see how it's very close to the end of being maybe a little sketchy, a little frightening. So now, so if there's no purines, there's derivatives that come from purine. That is there's one called hypoxanthine, right? And if there is low or minimal hypoxanthine, that is a telltale sign that there's minimal or absent purine, right? All right. And there's another laboratory test that you can perform. It's called a molecular genetic test. And basically what it is, you take chunks of DNA, you read it bit by bit, and do your best to identify any abnormalities. And of course, if PRPS1 is not correct, that is a telltale sign that ART syndrome may be present, may be the diagnosis, right? So what is the epidemiology? How does this transfer in a family tree? So a woman who produces offspring will have a 50% chance of giving it to each one of their children, right? And like I said before, men do not reproduce because they don't live beyond early childhood, which is around ages 8 or 9, right? All right. Now, as I mentioned before, the prognosis, males will not survive beyond 8 years old, and women will live pretty fine, other than the optic atrophy that they will be expecting on their early 20s. So, and even then, this is in some cases of ART syndrome. So women have it way better off in this disease right here. Now, what are some treatments that can be done to treat ART syndrome? So some things that can be done is have cochlear implants. Those help with hearing and to relieve all the permanent damage that has been done to the inner ears, organs, and nerves. Since they have hypotonia, they'll more than likely need a ambulatory assisted device, perhaps a cane to allow them to walk, ambulate. And for optic atrophy, there's not much that can be done because the technology has not been created for them to fix optic atrophy, right? And one thing very important to mention is that URIs, upper respiratory infections, are very prominent and recurrent in boys that have ART syndromes. That is because if their immune system is much more weaker and they already have hypotonia. So you can just imagine how the muscles are struggling to even inhale and exhale. So with that being said, they'll more than likely be on respiratory assisted devices. And immunizations are very important. Their immune system is compromised already, so they have to be up to date, and it's a must. It has to be done. Ataxia, which is the impaired movement of muscles, what they can perform exercises for their specific muscles, for their limbs, physical therapy, occupational therapy, which really focuses on how to do daily tasks of putting on your shirt, getting in the shower, putting on a backpack, simple things like that, tying shoes, and rehabilitative medicines that really help try to relieve the pain of sorts. And there is one breakthrough that's going on with the Australian family that I mentioned before, and that breakthrough is a dietary supplement called S-adenosylmethionine. It is abbreviated capitalized SAM, lowercase e, And this has helped the Australian arts syndrome patients with less hospital visitations, which means their URIs have lessened. They have less upper respiratory infections, and their nightly scheduled breathing treatments are much more regulated. Well, that's my presentation. Thank you so much. All right, so, and here's an example to represent optic atrophy. So what you can do, you can grab your friend's glasses, your family members, and just put them on. And you can easily tell how automatically, like, your vision is totally impaired. It gets blurry, it gets off track. Now, don't have them too long, but that is a very easy way to show how optic atrophy can really affect your life.